Hi, my name is Sammie and my presentation is on chondral fissuring in the patella. So the patella is a small, flat, movable bone that protects the knee joint. This bone is held in place by the quadriceps tendon and the patellar tendon. The femur, tibia, and the patella form the knee joint and are covered by articular cartilage. And articular cartilage is a type of tough, slippery tissue that covers the ends of bones and joints in joint cavities and provides a cushion. Cartilage helps protect and prevent the bones from grinding together, so this helps when you're during walking, running, or bike or bending your knee. So as you can see in this picture, the patella kneecap, so right underneath is the articular cartilage preventing from the grinding motion. So what is chondral fissuring? It is also known as patellar cartilage or chondral defect, and this occurs with when the articular cartilage that lines the patella becomes damaged or cracked. Again, as you can see in this picture, this is damage to the cartilage. And usually with the chondral defect or damage to the cartilage, you tend to get cysts either in that articular cartilage or in the back of the knee. So some causes are long-term wear and tear, a traumatic injury, sudden twist or blow to the knee, and disorder of the knee. So and some symptoms are anterior knee pain with prolonged or intense activity. So you're walking and going up the stairs, swelling or stiffness of the knee, knee instability or buckling. So giving away, giving out, and cannot support your weight. And then noise during movement may creak or have a grating sound, and then locking or catching. So the diagnosis is the doctor will perform a physical examination of the knee, and they'll assess for swelling, decreased range of motion, and the stability of the joint. And then they will collect a history of the patient's activity levels and recent injuries. It can be difficult to diagnose this type of injury, so further stuff they do is x-rays, which can show the space between the femur and the kneecap. And usually if you have the chondral fissuring, that space will be narrowed. And then further on, they'll do MRIs, which will reveal the damage defects in the articular cartilage. So there's 4 grades, and the first one is softening or slight indentation of the cartilage. The second one is a small partial thickness or fragmentation of the cartilage. The third one is larger or deeper lesions or fragmentation of the cartilage, and the fourth one is full erosion of the cartilage resulting in the exposed bone. So this would be when you're walking up the stairs or running or whatever, it's the grinding of bone on bone, which we don't want. So some non-surgical treatments are anti-inflammatory medications, icing therapy to reduce swelling, physical therapy, so strengthening the muscles around the patella, because cartilage cannot regrow itself, so really the only way is to strengthen those areas around it. And then injections of steroids or hyaluronic acid and weight loss. Some surgical treatments are joint arthroscopy with debridement, and this is a procedure where they remove the broken bits of cartilage and tissues to help reduce pain and improve movement, as you can see in this picture. And then some other ones are osteochondral autograft transplantation, and this is where they remove harvesting bone from an intact cartilage from less wearing weight portion of the knee to fill the defect in the weight bearing portion. And then the other one is osteochondral allograft transplantation, and this is where they take a piece of tissue containing bone and cartilage that is taken from a cadaver to replace the damaged cartilage. And then the last one is tibial tuberal osteotomy, which is a surgical procedure that is performed along with other procedures to treat patellar instability patellofemoral pain, and osteoarthritis. So basically, this is where they tighten your tendons for that knee stability. And prevention is to maintain a healthy weight, warm up before exercising, strengthening your knees, and opt for low impact exercise if you experience any knee pain. And some current research is patellar chondral defects represent up to 34.6% of defects found during routine arthroscopy. So currently the only technique that achieves this is OAT, which is osteochondral autologous transfer. And although there has been excellent results that have been reported during follow-ups, there is little known about isolated patellar defects. And thank you.